Speaking of liability, tonight a 5 on Your Side investigation as families grow more and more concerned about loved ones in nursing homes. Might be a lot tougher to sue them.
5 on Your Side Chief Investigator Ron Regan joins us now. And Ron, you found proposed state legislation that's raising some concerns.
Well, long-term care facilities are among the groups that could win additional protection from lawsuits as a result of the coronavirus. In long-term care facilities across Ohio, more than 4,600 residents have tested positive for COVID-19 since April 15th. Rick Rossi's worried about his 81-year-old mother-in-law.
And at the end of the day, the loved ones, we can't help them. We can't see them. We can't get things to them. And all we can do is interpolate over the phone what is happening on the other end.
She's a resident here at Grand Village Retirement Community in Twinsburg, among 43 testing positive for COVID-19, plus 3 staff since April 15th, according to health department reports, prompting concerns about conditions inside.
The state doesn't want to send anybody to do any investigation because of COVID-19. And the nursing homes are doing what they think is best, but there's no one to supervise their supervision.
The family is not filing a lawsuit, but Ohio lawmakers may make it a lot tougher for others who might. This proposed legislation extends immunity to nursing homes, medical providers, and private businesses. Peter Van Runkle heads up the Ohio Association, representing long-term care facilities.
Is it fair to go after those sort of protections?
Our reaction is absolutely.
The nursing home industry argues it can't be held liable for a virus that spreads so easily, while regulations are frequently changing.
To expect providers or any other business to, have a playbook and follow that playbook from the beginning is just unrealistic.
And could be financially devastating. Grand Village is among 3 other long-term care facilities in Ohio owned by Springer Healthcare Systems, including Smithville in Worcester, with 65 resident cases and 23 staff. Together, they're among the highest COVID-19 cases in the state, at least 171.
If a provider happens to have a large number of buildings, it's almost guaranteed that they're going to have some that are affected by COVID.
In a statement, Springer said, because it has a larger resident population, there are more potential opportunities for the virus, adding it's even provided best practices for infection control for a CDC webinar. But as state inspections are curtailed due to the outbreak, advocacy groups are opposed to limiting the ability to hold nursing homes accountable in court.
We feel that strongly without any outside oversight, that's very important. No outside eyes on the families, that how can we predetermine what should be litigated and what shouldn't be without knowing the facts?
While families like Rick Rossi have a message for facilities and health officials.
Takes a look at the processes to make sure that they're good processes being used to prevent the spread of the virus. And I do not feel that way now.
Well, this proposed legislation would make any lawsuit prove that a facility acted with bad motivations rather than simply making a bad mistake. I'm Chief Investigator Ron Regan.